Revamping websites is not easy. Adding functionality to an existing website, also not easy. That's why I'm excited to sit down with my next two guests, because they've been on a website journey to not only add functionality, but to build a website such that 2 or 3 years down the road, when they need to add new features and functions, they won't have to take down the whole site again and rebuild it from scratch. And that, I think, is a huge frustration for a lot of healthcare marketers. Hello and welcome to Sway Health, where we bring you the latest insights and interesting stories from the brightest minds in healthcare marketing. I'm Colin Hung, and I'm going to be joined by Steve Barry, who's a product owner at Lee Health. That's right, you heard me, product owner, not a role that we hear a lot about from within a healthcare organization. Part of the reason why I'm excited to sit down with him. And also joining him is Ben Seals, CEO of Reason One. They're going to talk about the website journey that they've been on and all the improvements that they've been making in order to improve the patient experience as well as staff experience. Let's get to it. Steve, Ben, welcome to the program.
Thanks so much for having us.
Thank you. Thanks for having us.
Now, you guys were just on stage talking about the wonderful website work that you're doing, Steve. Can you give us quickly some highlights of that work and what it was meant to achieve?
Yeah, I mean, a couple of the projects we highlighted on our presentation. We have our Golisano Children's Hospital project. We kind of took a couple of different problem pages that we had and we combined them together and created a faux microsite that really kind of streamlined all of the customer journeys and the user experience and solved some problems for us. And yeah, so that was a great project. It saved us a bunch of money. We didn't have to go out and build a whole new website. Another project, we've done some great work with our urgent care self-scheduling. We've added wait times onto the website, and that also allows patients to come and not only see what the wait times are at our convenience centers, but they also can schedule a same-day visit, so they don't have to go sit in the waiting room. So that's been a great example. We've also built out a Get Care section on our website, which basically guides patients to our care options based on their symptom or condition. And that leads into an interactive symptom checker, and then goes out to our various care options, one of them being a new e-visit platform that is really a great platform for both patients and providers, and allows them to kind of message back and forth. So that's been really neat. And then we're also doing a project integrating with the source of truth for our providers and locations and syncing that with the website to automate our provider profiles. So a lot of cool projects that we highlighted in the presentation.
And it sounds like it's a real mix of really trying to improve your operations and making things easier for your staff, but also you really considered the patient journey here, like in terms of the symptom checker and finding a doc and matching them. And did you work with a lot of your team to kind of really map that all out and kind of identify the points where you were going to make some changes?
Yeah, I mean, in terms of, a lot of it's our IS department. They're the ones that are, diving into the tech and all of that, like our symptom checker and eVIS platform, like that was all them. And then our, place in that project is, to make sure that we can guide patients to it in the appropriate ways and, build out those customer journeys and provide the context around it. So it's really a team effort. It's, it's not just our team, it's also our IS team and all the great work that they do. So yeah, it's really a partnership. And then with all of Ben's team and his help and, making that all happen. So it's really a team effort.
That's a great segue, Ben, to talk a little bit about some of the work that you helped them with. Like, talk to me a little bit about that.
Sure. Well, I mean, Steve and his team are doing the work ultimately, and what we try to do is provide a continuous improvement framework, right? So that they can work on a quarterly basis to evolve the website rather than having to burn it down every couple of years like we all do, right? Riding that roller coaster. And I think one of the reasons that Steve was able to achieve a lot of the outcomes that his team did was because of his role as product owner. I think a lot of organizations don't have a single source of truth for the website. It's owned across a different number of departments and teams, marketing and whatnot. And so his role as an integrator, as someone who is a user advocate and a trust builder, both between the system and patients, but also between his teams. He makes marketing and IT work together, which is amazing. And I think it's a testament to his role and the accountability that he brings to Lee Health.
That was a lot of some of the topics that were discussed here at the conference, where it's just, how marketing can work really more closely with IT and how there's a need for that. How did you bridge that gap, or how do you bridge that gap?
Well, it's honestly, it's just relationship building. It's, working with our teams in IS. There's one person I work very closely with, and honestly, he's kind of been a mentor to me within the system. He helps, introduce me to people and helps me understand like what the processes are and all that. So over the years, he's been a tremendous resource for sure. And then like all the various teams that I've worked with, it's just about, I always try to help them out. They come to us with questions or need something, and it's just always just willing to be give a helping hand to people. And, usually that kind of creates a good relationship, and, you help each other. So I think that's really what it's about. So.
What was interesting too he's an integrator, he brings people together. But what was amazing is even when there's requests, he frames it in the context of the user experience, right? That patient experience. And he will bring his own ideas to the table to really try to come up with the best solution that still meets the original request, still meets their need and their desire, but puts it in the right context so it can produce outcomes. They're really good at it.
And talk to me a little bit about the benefits. What are some of the things, now that the changes have been done, what are some of the things that you realize in terms of throughput or improved scores? Like, what's the impact been, basically?
It's all been, very positive. We showed some stats in the presentation for those projects. Just for example, with our provider source of truth database project, we're projecting that's going to save like 40 hours per week of staff resources. So they can actually work on value-adding activities than just kind of pulling their hair out doing data entry and, trying to figure out all of the issues, sorting data out. So that's a great example. What was another one, Ben?
I think the get care options.
Yes. We had the patient satisfaction score with going through the symptom checker and using the e-visit platform. I think it's like 97%, and we've cut down provider time spent per patient, so it's great for them too.
8 minutes per visit.
Yeah, I think that's what it was, something like that. So just all of our improvements really have shown in the stats.
It just shows that you were very aligned, right? The improvements that you did put in were aligned with what people wanted, and you're seeing the results in terms of the SAT scores, the happiness of both your staff and patients.
Right.
When you kind of design something in an ivory tower, you'll get a disjunct, right? You'll say, oh, I implemented it, but we didn't see the needle move.
Right.
From the presentation you gave and the results you're talking about, the needle clearly was moving there.
Yeah, for sure.
So what's next? What are some of the exciting projects that you're working on next?
Oh man, so our big project right now is, we're the one thing we haven't really spent a lot of focus on improving has been our services section on the website. And I'm, working with Ben's team right now and trying to sort all that out, and really how can we evolve that section and really make it, a much cleaner user journey for everyone, and really improve that patient experience. So that's the big one we're tackling now. I think the kind of longer term, we're also thinking ahead about, what's our future tech stack look like? I think web technology is evolving. There's a whole new composable approach to it. So that's something we're looking at and just trying to figure out, how does that fit into the rest of the efforts that, Lee Health is making towards that digital transformation journey. So we're got to figure all that out, a lot of puzzle pieces to fit together. So those are kind of like really two big ones that are, kind of what's next. So.
I think it's healthcare. We're perpetually trying to fit all the puzzle pieces together, right? That never ends.
It's feature, not a bug.
That's right. That's right. That's as designed, right?
Yes.
Well, Steve, you've shared a lot of great information. Where can people go to learn more about Lee Health?
Yeah, you can go to leehealth.org. That's our public-facing website that we've been working on. www.leehealth.org.
Awesome. And Ben, where can people go to find more about Reason One?
reason1inc.com.
Excellent. Well, thank you to both of you for being on our program today and for sharing this great insight. Really appreciate it.
Thank you so much, Colin.
Hey, I want to thank Steve and Ben for coming on camera with me and giving us that tremendous behind-the-scenes view of their website journey. I found it really interesting how Steve was able to bring together all those multiple parties, whether it was IS, the patient experience folks, and marketing department, to really come together in order to design a website that was going to actually make a difference for both patients and staff. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to Sway Health, that's Sway with 2 A's, .health, where you'll find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.